Good evening, my name is June Hollins, and I am going to perform the medication administration checkoff. This is my badge. This is the room. I am professionally dressed according to USACOM policy, planned medication administration to avoid interruptions. Close the door to the medication room. Do not answer any calls or receive any calls. Or do not take any calls. Limit conversations with your colleagues only to essential information, and follow your agency's no interruption zone policy. I'm now going to compare my patient care order form to my medication administration record, and I will show you that too. So here's the 2 pages of my medication administration record. Right now I'm going to compare. So the first thing is for the patient, we have Jaguar J. Jones, medical record number 4176352, medical record number 4176352, 4176352. Date of birth is 8/25/1963. Date of birth is 8/25/1963. Now I'm gonna go to right medication, which is morphine sulfate, right medication, morphine sulfate, right dose, 5 milligrams, right dose, 5 milligrams, right route, IM or intramuscular, right route, IM or intramuscular, right time every 4 hours, and right indication, PRN for pain, right indication, PRN for pain. So for PRN for pain, it's as needed. So as needed for pain, so morphine helps with pain. Morphine sulfate helps with pain. And now I'm going to look at the allergies. So my patient is allergic to penicillin and allergic to penicillin on my medication administration record. So I'm going to get rid of my patient care order form. Now I'm going to perform hand hygiene. And I am going to start my first round of 7 rights. So right patient, Jaguar J. Jones. Right medication, morphine sulfate. So we have morphine sulfate in this vial, and it's labeled morphine sulfate. The expiration date is 12/20/2025. So 12/20/2025, and it's morphine sulfate 10 milligrams per milliliter. And morphine sulfate, and I am going to just compare it. Morphine sulfate. So now I'm gonna go to right dose. So I have 5 milligrams, but in my vial I have 10 milligrams per milliliter. So I'm gonna take my 3 milliliter syringe, and I'm gonna take that, and I am going to do a half milliliter of morphine sulfate for 5 milligrams. So I'm gonna take my blunt tip cannula, and I am going to screw this on, and I'm just going to put a half a milliliter of air in here. So we have a half a milliliter of air. A half a milliliter of air. And now I am going to take my vial and I'm going to take an alcohol wipe and wipe around my vial. to take my tip off, insert it into my vial, press the air down. I'm going to get a 1/2 milliliter out. I might get more to get rid of the bubbles. And I am going to do the scoop method. And just look at the volume. Okay, no more bubbles. So this is my 1/2 milliliter of morphine sulfate. And I'm gonna get a nurse to check my dose and also my calculations. So this is my dose, which is 5 milligrams, which is a 1/2 milliliter in a 3 milliliter syringe. Then I am going to check for the right route, which is IM, intramuscular. So I am going to use my 3 milliliter syringe. And I got the blunt tooth cannula on so I can get the medication, but I am then going to change it out for the 21 gauge 1-inch needle. So then I'm going to look at my right time, and it's every 4 hours, which means that well, my patient hasn't had this drug prior to me trying to get it ready for him. So he hasn't had this drug in the last 4 hours. And then we're gonna go for right indication, which is PRN for pain. And PRN for pain is as needed. So my patient was in pain and he told me he was in pain, so we give him the PRN as he needed pain. We give him morphine sulfate as he needed pain. Morphine sulfate helps. And then we're gonna go for right documentation, and all elements of a legal prescription is included. Okay. Now I am then going to go to my second round of the seven rights. So we have right patients, which is Jaguar J. Jones, right medication, which is morphine sulfate. I have morphine sulfate right here that I had syringe. So morphine sulfate compare 10 milligrams per milliliter, expiration date 12/20/2025. So that's good. Morphine sulfate. All right. So now I'm gonna go to right dose. So I have there is 10 milligrams per milliliter in my vial, but I want 5 milligrams, so I have a 1/2 milliliter in my 3 milliliter syringe. So I have my right dose. 5 and 1/2, okay. And I also got this checked with the nurse, and she also checked my calculations. So she checked my dose and my calculations. I am then going to check my route, which is IM, intramuscular. So I have my 3 milliliter syringe, and I have my 21 gauge 1-inch needle. So I am going to check for the right times, which is every 4 hours, and my patient hasn't had any morphine sulfate in the last 4 hours. And then the indication is PRN for pain, and so as needed. So morphine sulfate as needed, and he told me that he was in pain. And so now right documentation is all elements of legal prescription are included. So now I am going to just sit this down, and I am going to write a label. and on my label, I am going to have the right medication, which is my right medication, my patient's name, and the right dose. So the right medication is morphine sulfate, and I have morphine sulfate. Right dose is 5 milligrams, so but I have a half of a milliliter for the 5 milligrams. And my patient's name is Jaguar J. Jones. So I am going to place this on here, being careful not to cover the numbers that I need to see. But I'm also going to take my blunted cannula off. And put my 21 gauge 1 inch needle on. Really tight. Okay, now I'm going to take my vial medication that I created and my medication administration record to my patient's room. I am going to perform hand hygiene after I knock on the door. So I'm knocking on the door, perform hand hygiene, and I am basically going to let my patient know about the procedure. So, hey, Mr. Jones, how are you doing today? My name is Joan Hollins, and I am going to be, and I am a student nurse at the University of South Alabama, and I'm going to be your nurse today, and you're a student nurse today, and we're going to administer morphine sulfate to you. Is that okay with you? Yes, okay. So I'm going to raise the bed up to working height, and I'm going to lower those side rows. I then am going to check my patient's armband, and I'm going to compare it to my MAR. So right name is Jaguar J. Jones. Right name, Jaguar J. Jones. Medical record number 417-6352. Medical record number 417-6352. Okay. And then I am going to assess for allergies. So I see that on my patient armband, he's allergic to penicillin, and he's allergic to penicillin in the medication administration record. I am then going to do a pre-assessment. So I'm going to look at the blood pressure. I'm going to look at the before I even do that, I am going to ask my patient, is there any other allergies that I need to know about, that we need to talk about today? Okay, he says no. So then I am going to I'm going to do a pre-assessment, and I'm going to look at his blood pressure, I'm going to look at his pulse, and I'm going to look at the pain assessment. Alright, after that I'm going to set this aside. And I am going to go back and look and start on my third round of 7 rights. So I already did right patient, but we can still do it again. Jaguar J. Jones, medical record number 417-6352. So we have Jaguar J. Jones on my label. Then we're going to do right medication. Right medication is morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. Right dose is 5 milligrams. So I have 5 milligrams, but I did a half a milliliter in my 3 milliliter syringe with 5 milligrams. So I converted it. So I check that. Right routes, intramuscular. So I have my 3 milliliter syringe, and I have my 21 gauge 1 inch needle. Okay. Right time every 4 hours, and my patient hasn't received any of the morphine sulfate. Before 4 hours, or before I'm giving to him. He hasn't received any medication yet. Okay, so now I'm going to do the right indication, PRN for pain. So as needed for pain, morphine sulfate is for pain, and my patient said he's in pain, so I'm giving him pain, the morphine sulfate medication. And write documentation, all elements of legal prescriptions are included. Okay. So now I am going to set this down. I'm going to put on my gloves. And my goggles. And I am going to be giving this medication, administering the medication intramuscular at a 90-degree angle. So I'm just going to look at my patient's skin and see if there's any bruises or anything like that. And then I'm going to take a alcohol wipe. And I'm just gonna clean my patient's right. And then I'm going to take my cap off. I'm going to place it at a 90-degree angle. I'm going to aspirate to see if there's any blood, and it's not. And then I'm going to give it really slow. And before I do that, I'm going to spread the skin and give it really slow. Take it out and press on it with the alcohol wipe. Then I'm going to put that right there. I'm going to place this in the sharps container. In the sharps container. And then I am going to take off my gloves. Take off my gloves. Perform hand hygiene. Look at the patient, see if there was any, if he was allergic to the medicine, if there was an allergic reaction going on. I would then put him in a comfortable position and let the rails back up, and then I would go and document. So I'm documenting on the MAR, and then I'm documenting the patient's assessments and like their indications. So he was, I was assessing him for pain because he said he was in pain, and so I would come back and assess the pain, or my patient. I would assess my patient and see if he's in pain again, or in pain still or not. And I